Hello, my name is Joe Pons Laplana, and I currently working at Health Education England as a project as an area manager for Project Choice. And when I did my school for health change agents, I was basically a community nurse, a band five, who was interested in making change happen, and I wanted to know how, and that's why I joined the school for change agents. I was I was the first cohort that in 2017. I was the first radical. I still find myself as a radical. I like the concept of being radical that Helen Bevins introduced me and opened me a new world to me. And that was for me the first time somebody told me you are allowed to change things, because before where every time I tried to do something, I found a lot of barriers. My manager didn't listen to me and everything. I was not going nowhere, but the first time there was a corporate message who was telling me change something, you're allowed to change it, I give you permission. And that for me was the first time that I got involved in quality improvement. As a student nurse, everybody should learn about quality improvement. That transformed not only the way we work, we suddenly found that we were capable to visit everybody, but also the patients got a lot happier. And also for the first time, the same patients nominate me for an award as the going the extra mile of compassionate care. That was my first time that um, I saw, wow, what an impact quality improvement, just a small change can have, not just on me, on the way that I'm less stressed. I can visualize all the patients need to see and everything, but also for the patients because they were not left in limbo, not knowing who's going to come, when is going to come, or anything. And as simple as that, um, make a huge impact. And then Jackie Linton, that she invited me for a gathering down in London to basically to present my learning and to present that change in front of other people around the country. That was my first time that I also spoke in public, and I was shaking. And that also that day, it transformed my life because I was involved suddenly in quality improvement. I found my tribe. My career was more or less going nowhere. From after I went to school for change agents, my career rocketed, and I got involved in quality improvement. And I suddenly got a band six, band seven. I went to a band eight. I was involved in national projects with NHS England. I was involved with the caremakers, with the school for change agents, and then I got also involved in changing microsystems in my hospital. My teams suddenly were winning awards. We won the HSG award. We won the other patient award. We won other. We won patient safety awards, and in 2018 I was nominated. I won the Nurse of the Year award for the transformations that I did and my team did at James Paget Hospital. That was amazing. But the most amazing is that with the projects we were doing, we were reducing mortality, saving life, improving quality of care, and thought that from a very simple tools that the School for Change Agent gave me, basically unleash my full potential. And I forever I recommend anybody to do that because it's an introduction and it's a basic course. But wow, in that 6 or 7 models it was. They were absolutely amazing, and each one of them I absorbed all the content, and then I took it into practice. It's been amazing. You need to know if what you're changing is good or bad, and you need some tools. And the School for Change Agent give me fabulous tools, but also show me how to do change properly, show me how to connect with people, and how to go from myself to create a movement and to engage with other people and do it together. Because at the moment I was doing change on my own, trying to change things, and that also was quite difficult. And that's what I learned at School for Change Agents. You opened me a new world of quality improvement. And since then, I have achieved things that I will never thought that was able to achieve, or to be in places I will never be able to be in places, or the better thing is to improve healthcare systems that I will never thought that I was capable of doing it. When I landed in this country 21 years ago in Luton with my suitcase, with 50 pounds in in my pocket, and a bit of full of my suitcase full of dreams. The other thing I learned from the School for Change Agent is that um, fun. You need to have fun in any project you do. In any project you do, you need to have a part of fun. Suddenly, all the barriers get blurred, and everybody join as a one, and everybody's equal. When the people are having fun, you don't really consider, oh, I cannot say that because the consultant, or I cannot because the cleaner. Everybody suddenly become the same involved in the project, and that's for me the most powerful, very powerful from giving the element of the fun. Makes everybody feel the same, and makes everybody feel value exactly the same, without any ranks, or any labels of who is who. So somebody then suddenly all the team are that, just a team. And for me it also is a lesson that I learned from School for Change Agents. It gave me power. It gave me a language to go to managers, because the managers, I realized also, they have a different language that the patients, the doctors, and managers, they want to see improvement. They want some numbers. And I was able to have these numbers and say, look, because of the change we have made, we have managed to see 6 more visits every week. And that means the waiting list has reduced. And I was then at the same time, I was learning about the narrative and the different ways to go around the system. And then when I was talking to nurses, instead of saying data, I was talking about patient satisfaction and making a difference. And then when I was talking to patients, it's all different. That I also learned that change is not just numbers and improvement. It's also connecting with people, and talking the same language, and create a common purpose. And that for me was very powerful. That very powerful tool that I learned. For me, the most important is being the storytelling. If somebody say, which one is your best weapon, or the weapon to recommend to everybody, is to know, to connect with the how, and to have a narrative together, because that for me is the most powerful thing you can have. If you manage to connect with the how and the why with the people, don't worry about the other tools, because they will come. But the most important is that if you fail to connect with the with the how and the why, no matter how good you are using tools, that things the people will resist to change. I found the School for Change Agents not just give me the tools, give me a community of other people doing the same in other parts of the countries. And then I started saving a lot of times. Because before, when you have a problem, you used to gather data and try to change. Now, the first thing I did after having this network is to go to network and say, look, I have this problem. Is any of you had the same problem? Have you found any solutions? And then the people used to contact me and say, oh, we managed to do that. We have these things. And then I used to save 2 or 3 months of work, because say, well, why reinvent the wheel? If somebody had the same problem and have managed to put the solution in works, and then let's try to bring it and see if we can adapt it and make a difference. Then that's for me the beauty, that these connections making also feel that my problem is not just the problem of my trust, and is a common problem, and try to find this common denominator with a lot of other change agents, making for me a lot easy to find. Basically, I call them Aladdin caves, because they are full of treasures. When you open the door of these resources, and you will see that not you're not the only one having this problem, but not only that, they already have solutions, and you can pick and choose and create your own solution. Because I did believe that nursing needed to have a stronger voice. And I use the methodology of this that I learned at School for Change Agents, to try to be more visible, to try to take nursing onto other places that they've never been before, and to meetings that the normally nurses are not invited. Just take my own deck chairs, and people say, "Oh, why are you doing that?" I say, "Well, why not?" My first experience of trying to change things, that I got sacked of my job because I tried to change the system without any tools, and I was very confrontational with my manager. And obviously, if you're confrontation with your manager, the chances are that you're going to lose your job, and and that's what happened to me. Till how everything changed, and I went from being sacked to win Nurse of the Year award in a space of 3 4 years, and make it hope a reality is the most beautiful emotion that you can have. And I haven't found any sensation that equals of making this hope or this change a reality, and seeing how mortality is being reduced, how little changes, how people are adopting the new change, and how the system gets better, not just for people but also for nurses, the people who work on it, and the people who are receiving it. For me, uh, it's I discovered that drug. For me, I call it a bit of a drug. Change the and the school for change agent, making things happen is amazing. I had the good intentions and I know what I wanted to change, but I didn't know how to change it. Narrative is very important to bring everybody with you, not against you, because change is difficult by itself, and change is against any human nature because we all like to know what's happening and everything. Suddenly, if you change something, people get anxiety, get a bit unease, because also in a way you're questioning the way of doing. They've been doing the same thing for a long time. So here is Joe come and say, no, we need to change it. And people think, oh, are we doing things wrong? And this not. Is that like Darwin says, the things change. We need to adapt to the change. If we don't adapt, then the species die. It's like we cannot care for the people the same way we care in the 80s or in the 90s, because the kind of care we need to provide is completely different. Love the school for change agents because it have opened me and unleashed my potential. Before that, I was a bit of a rebel trying to change little things. With change agent, as a change agent, I have managed to change systems and to make the NHS better and to make a difference. Without that tools, I will have never been able to achieve what I have achieved. And for that, I will ever be grateful. And I recommend anybody who do School for Change Agents.